right, good evening. Thank you all for joining us. My name is Nancy Toohill. I am the peer facilitator for the Let's Talk About It program with Share Cancer Support. Before the presentation begins, though, I'd like to tell you a little bit about Share. Share is a national nonprofit that supports, educates, and empowers anyone who has been diagnosed with women's cancers and provides outreach to the general public about signs and symptoms. We are a compassionate community of knowledgeable survivors, women living with cancer, and healthcare professionals. Share is dedicated to serving women of all races, cultures, backgrounds, and identities, because no one should have to face breast, ovarian, uterine, cervical, or metastatic breast cancer alone. For more information, please visit our website at sharecancersupport.org. We're going to ask that all participants please stay muted during the presentation this evening, and I can also mute you on my side if you don't know how to do that. But we would love to see you on camera, so please feel free to join us via video if you'd like, so that we can see your happy faces this evening. When Dr. Bao finishes her presentation, we will have a Q&A discussion. You're welcome to submit questions in the chat box at the bottom of your screen. I think that'll kind of keep things rolling a little bit more smoothly. And if there is a question that's directly related to what Dr. Bao is talking about, I'll interrupt and ask that question while she's speaking. So if you have something pressing that you'd like to ask, please feel free to go ahead and ask it while she's speaking. And now I would like to introduce our speaker. Dr. Bao is the immediate past president of the Society for Integrative Oncology, SIO, and the current co-chair of the SIO Education Task Force. She is a joint faculty member at Memorial Sloan Kettering Cancer Center, MSK Integrative Medicine and Breast Medicine Services, and the director of Integrative Breast Oncology Program at MSK. She is a board-certified breast medical oncologist and a medical acupuncturist and an integrative medicine physician. So please join me in welcoming Dr. Bao. We're so thrilled to have you this evening.
Thank you so much. Thank you, Nancy, for the wonderful introduction and for inviting me. And thank all of you for joining us on a Tuesday evening at 6 o'clock Eastern Standard Time. So it's really my pleasure to be here. So I'm going to share my slides. Hold on one second. So I'm going to start with the right slide.
Record.
Great. Can you see it? Okay, great. Thank you. Okay, let me get started. So so today I'm really talking about complementary and integrative medicine for triple-negative breast cancer patients. So myself, I'm board certified medical oncologist focusing on treating breast cancer patients. I'm a medical acupuncturist. I was trained at the Helm Medical Institute affiliated with UCLA. I came to Memorial Sloan Kettering Cancer Center 8 years ago and was trained to be an integrative medicine physician as well. So every Tuesday, I see integrative medicine patients and acupuncture patients. Every Wednesday, I see breast cancer patients. And the rest of the time, I do research. So I'm a physician scientist, basically conducting integrative oncology clinical trials. So far, I have completed 6 pilot studies, and right now I have 2 ongoing NIH-funded large multi-million-dollar grant running 2 phase 3 randomized controlled trial, and I'll tell you a little about them. And then my lifetime goal is really to try to integrate complementary medicine into oncology practice to improve each patient's quality of life and overall survival. So today, first, I want to define the difference between integrative medicine versus alternative medicine. And then I'll talk about different kind of integrative medicine therapies for breast cancer patients. And then we summary, and then we have Q&A session. So let's start with the difference between integrative versus alternative medicine. So it took us many, many years to kind of really distinguish this two. So integrative medicine, I think the most biggest difference is whether it's used alongside with the conventional treatment, whether it's complementary, or is used instead of the conventional treatment. If it's instead of, then it's called alternative medicine. And then if it's used alongside, it's called complementary or integrative medicine. Other differences include integrative medicine usually is not necessarily invasive, it's evidence-based, meaning there's clinical trials behind it supporting it. And then relatively inexpensive and focusing on side effects and pain management. In terms of alternative medicine, usually it can be biologically invasive, and sometimes they make some like unsubstantiated claims saying this can cure cancer. And then some insurance don't cover this, so it's often very costly. Some insurance covers some integrated medicine approach. So that's the main difference. That's actually why we call ourselves integrative medicine, not alternative medicine. So there are different types of integrative medicine therapies, and that include mind-body therapies, massage therapies, music dance therapies, acupuncture, diet, nutrition, supplement consultation, exercise, and fitness, which we offer them all at Memorial Sloan Kettering Cancer Center's integrative medicine service. And when we talk about the CIM, complementary integrative medicine therapy, we usually divide them into 4 groups. So group A usually is safe and helpful. Everyone should be doing it. Group B is like safe and possibly helpful. We're still doing study to try to study it. Then we can discuss whether you should do it or not. And then C is it's useful, but with certain risk. Then you need to weigh the risk and benefit. And D is harmful and not benefit. Then you should not be doing that. One example is our carnitine. Reportedly is help with chemo-induced peripheral neuropathy, but we have done trials basically showing if you use it with chemo, it's actually make the neuropathy worse. So try not to use it. And then the type A treatment is actually that everyone should be doing it is this mind-body medicine therapies. It's safe and helpful. Research has shown that. So that include all this, like I would say meditation definitely has more evidence, and there's some evidence about hypnosis and guided imagery, biofeedback, breathing exercise. So as you can see, all of them has very little toxicity and potential benefit. And there has been lots of studies done. You can see there are 47 trials involving 3,515 patients. And then they look at the effect of meditation on different kind of cancer-related symptoms. And then it's usually really all favors meditation. And no side effects. So potentially, I think everyone should learn to do meditation. And then in terms of yoga, there's also meta-analysis suggests that yoga really help with a number of symptoms listed here and minimum side effects. So it's strongly recommended as well. And then the idea also is it's not just for patients. It helps our patients, but also help with caregivers and help our healthcare workers. So overall, I think it's good for everyone. And I strongly recommend everyone to learn to do those mind-body approaches. So A/B is massage therapy. So we know it's pretty safe. There are different kinds of massage therapy. We're doing more and more trials to see if it's helpful, if it's indeed efficacious. And then there has been some studies, for example, this one, randomized control trial of massage versus simple touch in advanced cancer patients. So as you can see, it really helps with pain and the mood. And may help with other things. So for breast cancer patients, we usually recommend massage therapy for different kind of breast cancer treatment related symptoms, such as the cording, after surgery, some people may develop this cording, and or mild edema or post-mastectomy pain syndrome or some kind of cancer pain. We are conducting, which is recently finished, a trial comparing acupuncture with massage to treat pain among patients with metastatic disease. And we just finished enrollment, so hopefully we'll have the result to share in a few months. And the music therapy is the same. It's pretty safe and potentially very helpful. There are studies on this. So in 2018, Society for Integrative Oncology and American Society of Clinical Oncology together put together a guideline for using integrative medicine for breast cancer patients during and after treatment. And the key recommendation, a number of them has like meditation and music therapy. As you can see, it helps with anxiety, stress reduction, and depression, mood disorders. So yeah, I strongly recommend music therapy. There are two types. One is sort of passive, and another is active music therapy. The passive one is you just listen to the music you enjoy. Usually it's like calming music, whereas the sort of active one is you work together with music therapist. You say compose a sort of a piece, and then that help you express yourself, etc. So we actually also have an ongoing trial, which I'll tell you a little about that, in comparing music therapy with another psychological intervention, cognitive behavior therapy, to reduce anxiety. And then acupuncture. So I'm actually an acupuncturist, so I know this by heart. So this is has been shown to be pretty safe, and we're gathering more and more information on the efficacy of acupuncture. So what is acupuncture? It's a traditional Chinese medicine technique of inserting and manipulating hairpin needle into specific point in the body, the so-called acupoints, to reach therapeutic effect. And what are those acupoints? So study has shown that it's usually high density of neurovascular structures and with low electrical resistance, and it's usually between or at the edge of muscle groups in fascia area. So there are about greater than 360 acupuncture points in the body and distributing along 14 major energy channels. And the typical session involves a comfortable bed, and the acupuncturists take 5 to 10 minutes to insert the acupuncture needles and stimulate it, manipulate it to the point patient usually have this qi sensation, feeling heavy, numbness, or tightness, and then leave the needles in place for 20 to 30 minutes. Acute condition, like you sleep wrongly or something, have neck pain, takes 1 session to get better. And then chronic condition usually takes like 4 to 6 sessions to feel better. But some people may feel better right after 1 session. And then the mechanism, there are actually a lot of mechanism, but studies basically suggest it appears to manipulate the the nerve system. And so there has been lots of data suggesting acupuncture help with different kind of cancer-related symptoms. The strongest data is actually on acupuncture help with pain and nausea, vomiting, and then it can help with hot flashes and dry mouth, and GI immobility, like disturbance or sleep problems. And there's some data suggests it's help with anxiety, fatigue, and depression.
Dr. Bao, is
Yes.
acupuncture recommended for neuropathy as well? We've had a couple of people ask that question.
Yes, I'm going to talk about that soon. Yeah, as you can see right here.
Great.
Yeah. Thank you. So specifically for breast cancer patients, the side effects, acupuncture can be used to reduce the side effects of aromatase inhibitor, can be used to reduce chemo-induced peripheral neuropathy, can be used to decrease nausea or hot flashes. We have done a study on acupuncture for lymphedema. It's not that beneficial, at least based on our protocol. So we don't really necessarily recommend using acupuncture to treat lymphedema at this point. So the first one is aromatase inhibitor-induced joint muscle pain. So lots of people with estrogen receptor positive breast cancer has this drug, and it causes joint muscle pain. As you can see, acupuncture reduce the pain by greater than 2 points out of like 0 to 10 points in about 58% of patients in the real acupuncture group, compared to 33% in sham acupuncture group, and compared to 31% in no acupuncture group. So, and then our other trial also showed body acupuncture and ear acupuncture both help reduce cancer pain, muscle joint pain. And then, as you can see, this is patients getting usual care, no acupuncture. And this is like patients getting body acupuncture versus patient getting ear acupuncture. So the body and ear acupuncture reduce pain by about 2 points. And then this is hot flashes. So as we know, lots of patients after cancer diagnosis, after chemo, develop hot flashes. And then the most effective treatment is estrogen treatment, but lots of patients couldn't use it. So integrative medicine approaches are needed. And then this trial basically shows among 190 patients, half get acupuncture plus enhanced self-care, and the other half got enhanced self-care. And then the acupuncture group helped reduce hot flash score by 20 points. And then the reduction continues at 3 months and 6 months follow-up. And then it also may help with insomnia. So the standard treatment for sleep problem among cancer survivors is cognitive behavior therapy. So it's lots of behavior changes and combined with meditation and other things. And it's effective and gold standard, but sometimes it has poor adherence and not responsive and not really accessible for lots of people. So some pilot studies suggest it helps, and it's available in like 73% of US cancer centers. And then we conducted a study, compare acupuncture with cognitive behavior therapy. Both intervention actually resulted in clinically significant reduction in insomnia score. CBTI is a little better than acupuncture, but acupuncture is still an option. And then this is a neuropathy. Sounds like lots of people are interested in this. So, neuropathy, chemotherapy-induced peripheral neuropathy is the main toxicity associated with chemotherapy. As you can see, so right now, the only one sort of approved drug to treat chemotherapy-induced peripheral neuropathy pain is the L'Occitane, also called Cymbalta. And then that reduced the pain by about 1 point on a scale from 0 to 10, compared to placebo, reduced the pain by about 0.3 on the same scale. And then whereas acupuncture, at the same time we conducted this study on 27 patients having chemo-induced peripheral neuropathy pain. And we showed that acupuncture was able to reduce the pain by about 20 out of 0 to 100 points. And importantly, I apologize, this overlaps. The L'Occitane can cause fatigue, insomnia, and nausea. And whereas acupuncture, most common side effect is mild bruising. So it's potentially worthwhile like looking into it further. So as a result, we first conducted this pilot study, acupuncture for persistent neuropathy symptoms in solid tumor survivors. So we have 3-arm trial comparing real acupuncture with sham acupuncture with usual care to see if they help with neuropathy symptoms. So this is our primary result. As you can see, the red line is acupuncture. So at week 4, it reduced the pain by about 1.5, and then continued at week 8 by about 1.7. And then with no acupuncture between week 8 and 12, the symptom reduction persisted. And then sham acupuncture, the symptoms reduction is reduced a little, but not as much as real acupuncture. And then after you stop acupuncture, that bounced back. And in usual care, the neuropathy symptom didn't change much. This is neuropathy pain mainly. Yeah, and then because of this promising result, we got funded to conduct this phase 3, like 250 patients trial, comparing real acupuncture, electroacupuncture versus sham acupuncture, different kind of acupuncture, and then follow up. So give them 8 weeks treatment and follow up. So that's our study design. And so far, this trial is open at MSK at 7 different sites. And then I'm the principal investigator, and my co-PIs include my mentor, Dr. Ting Bao, and then my mentee, Dr. Iris Zhi. So it's opening at all 7 sites in New York, New Jersey. And then so far, we enrolled 29 patients, and it's sponsored by NCI. We're hoping that we'll be finishing enrollment by the end of December 2024. Then we can present the result.
How do you define sham acupuncture?
So basically, it's different points and different insertion technique. Yeah.
Got it.
And yeah. And then, so for people who are kind of needle phobic and really don't want to be inserted by needles, there's always acupressure. So basically, you don't need to put needles, and then you put pressure on it. Use your finger or some kind of device, and it can be used to help reduce common symptoms such as stress, anxiety, agitation, and then it's basically it's sort of like self-massage, self-hypnosis. So I can teach you a few points. So number 1 is this intang point. It's between these 2 eyebrows right here. And then you just, if you feel anxious, you can just put pressure right here, just massage it for like 2 minutes. And then it's used to really help reduce anxiety. And then another point is this heart 7. So basically this is the wrist crease, and then this is the lateral part near your like little finger, and then you put pressure there, and then that can really help with depression and also insomnia. So if you have trouble sleeping, press here. So that's, yeah, you can do it like self-care rather than relying on acupuncturist. So another major thing we talk to patients about is diet and nutrition. So as you know, lots of like cancer organizations recommend activity and healthy diet at cancer diagnosis and beyond. So healthy diets are usually associated with survival benefits. And yeah, so we strongly recommend people to follow that. And study has shown that diet linked to increased risk of cancer include red meat for greater or equal to 2 times per week, and processed meat because of the preservatives, and alcoholic drink, especially for breast cancer. The more you drink, the higher risk of breast cancer is, and also foods containing too much sugar in it. And then there's also diet linked to decreased risk of cancer, such as non-starchy vegetables, like cruciferous vegetables, broccoli, Brussels sprouts, cauliflower, kale, and some fruit, especially those berries, which has lots of antioxidants, and also food containing lots of dietary fibers and vitamin D. So as a result, we summarize, we usually recommend diverse and balanced diet and emphasize on plant-based diet from good sources, like organic food is better. And every day we recommend people to have like 3 to 5 servings of non-starchy vegetable. Each serving is fist size. And then 2 to 4 servings of non-sweet fruit per day. That's primarily the berries. And then also some plant protein plus some animal protein to maintain balance. And then in terms of restricted diet, so limit red meat to 1 to 2 servings per week, and limit alcohol intake, and try to avoid processed meat, and then eliminate as much as you can the sugar, high fructose corn syrups, and artificial sweeteners. So I just want to mention like obesity right now is a major cancer risk factor. One study actually shows, granted it's children, the whole COVID era, children significantly increased risk of obesity among children. I'm sure it doesn't help with adult either. So, it's also linked with postmenopausal breast cancer and some other cancers as well. This is our trend, sadly. The redder it is, it's a higher the obesity is. As you can see, we're just definitely trending up. And then those are the health consequences of obesity. It's bad for basically every area. And then as a result, we recommend patients to have good diet and also lots of physical activity. So as we see, 25% of cancer cases worldwide are related to sedentary lifestyle and obesity. And exercise is a major focus of our research. And all exercise is pretty good, especially the one you will do. So the biggest difference is not like, lots of exercise versus a little exercise. The biggest difference exercise make is actually from sedentary, no exercise, to a little exercise. So everyone should exercise, even if it's just a little bit.
How is that tracked, Dr. Bao? How is the kind of sedentary, the cases related to a sedentary lifestyle tracked? I've never heard that, so I'm curious how that, how people got to that finding.
You mean how did it increase risk of? I think it's all like observational study, like look at like their risk, their lifestyle, whether they're sedentary or not, and then correlate with their cancer incidence. And then so it's all observational. I don't think there's a randomized control trial can randomize people into sedentary versus like very active. And there is also dosage responding as well. So the more people exercise, especially colorectal cancer, the lower risk of colorectal cancer they have. I may have it like in the follow-up the slides. But yeah, so basically, yeah, try not to sit for too many hours per day, and then try to get up every hour to walk around. And then the ultimate fitness goal is 30 minutes of sustained moderate intensity exercise, greater or equal to 6 days per week. So moderate intensity, usually, you sweat a little, but not profusely, and then your heart rate go up somewhat. And so anything, I think an example of sort of moderate intensity exercise is fast walking. And then that's it's actually one of the best exercises. The mechanism, how does it work? So physical activity can really change hormones, decrease inflammation, prevent obesity, like change different kind of hormones, and really help prevent cancer. Yeah, I have this. So exercise increase breast cancer survival. So we have nurse health study in about 3,000 nurses with breast cancer. And then with regular physical fitness, the increased survivorship was noticed. And then as you can see, the more, the better. Greater than 9 hours per week exercise is better than less than 3 hours per week. And then even reduce the risk of death from breast cancer. And then, yeah, so another major questions lots of people ask during the integrative medicine physician consultation is dietary supplements. So the idea is, the hope is really to meet nutritional needs through diet and not from those supplements. Mainly because you honestly don't know exactly what's the ingredients in there. Yeah, so whereas the whole foods, you pretty much know. And then, but regardless, there's so many people are using the dietary supplements by, especially among the cancer survivors. So you see those numbers, and this is 10 years ago. So I assume now it's even maybe more. And then the short answer for whether dietary supplements help prevent cancer is we don't know the benefit for sure. There's some conflicting data, need to be cautious, be careful. Mainly because there's some study, actually the result completely surprised people. A study shows dietary and supplemental vitamin D may reduce risk of liver cancer. And that's why NIH funded this huge cancer prevention trial called SELECT trial. Comparing, it's 2x2 table, like some patients get both selenium and vitamin E. Some get selenium with placebo, some get vitamin E with placebo, some get placebo only. And then they follow them, and unfortunately, at 7-year follow-up, significant increase in prostate cancer risk with vitamin E and selenium supplement. So this is kind of warning sign for people, and ever since then, people start wondering why. And lots of series came out. One series, before we know about this, lots of people are actually low in selenium and possibly vitamin E. And then more people start taking it. And then by the time they do this trial, lots of people's selenium and vitamin E level were not low anymore. Then more, not necessarily better. So in people who has normal level, you give them more, may potentially do harm. So be careful. I think there's a trend now, it's a U curve rather than just completely like the more is less cancer risk. But the U curve just means too little or too much actually increase the risk of certain cancer risk. So just right is better. And then in terms of vitamin D, and breast cancer, actually suggests vitamin D does help reduce breast cancer risk, but may not and really help with colorectal cancer. So for breast cancer patients, I usually recommend them to check their vitamin D level and supplement as needed. And also, if it's too much supplementation, I notice if the level is greater than 80, sometimes people have palpitation and other problems. So ideally, check the level every few months just to make sure you're not totally over. And we developed this website. It's called About Herbs website. We have like close to 3, this is set 280, but we added a few. So like close to like 300 different entries on different kind of dietary supplements and even like herbal supplements, and talk about clinical summary. And then I look at the mechanism of actions and drug herb interaction. And yeah, and sometimes dosage, and that would help. And so it's actually open to everyone, it's free, so you can look it up if there's some herbal supplements you're interested in taking. And then other things to think about the herb and dietary supplements is you need to be careful about their claim, and also the ingredients, and also the potential interaction with prescription drugs. They can interact with your medications through different ways. For example, like when patients are getting radiation and chemo, if they're taking the high dose antioxidants, that can potentially interfere with radiation, and then can potentially raise the bleeding risk. Some supplements can make the blood thinner. Therefore, if you're taking anti-coagulant medication, that can make you bleed more. And then some patients, if they don't, if they have estrogen receptor positive tumor, then some herbal supplements will, has phytoestrogen that may counter the anti-estrogen therapy. And then another way is indirectly interact. So lots of medications, drugs are metabolized, cleared from the body through those enzymes in the liver. And then many herbal supplements interact with those enzymes. So that's why you need to be cautious and ask your doctors whether you can or cannot take some certain herbal supplements. And when you talk to them, usually give them the dosage as well, because as much as you are concerned about all these ingredients, the total amount is only 20 milligrams. The chance of it doing anything is nothing. So dosage does matter. And then I just want to tell you a little. Yes, go ahead. Oh, so someone has a question. Anyway, so right now, MSK, we have the following few trials ongoing. So one is we have this acupuncture for chemo brain trial. It's called ENHANCE trial. This is funded by NIH. So if for patients with chemo brain and interested in trying acupuncture, you're welcome to contact us. And this is for now for cancer survivors. Unfortunately, right now, all these trials is for patients with no evidence of disease. We're actively trying to open trials for people undergoing chemo and also for patients who potentially has metastatic disease. And then the next one is our trial, the one I just mentioned, acupuncture for chemo-induced peripheral neuropathy symptoms. And then this one focus on pain. So if you have moderate to severe neuropathy pain, then yeah, so try to let us know. And then we can enroll you to this trial if you're interested in helping other women, helping the science to move forward. And we have another trial on pain patch, Tibetan pain patch, and this is for muscle joint pain among cancer survivors. And then our other trial is on yoga for CIPN. So chemo-induced peripheral neuropathy can cause balance issue. And then as a result, so people may have increased risk of fall. So, and yoga is known to help train people and introduce this mindful intervention. And they teach you breathing exercise, they teach you flexibility exercise and all this. And then can potentially really help prevent fall. So we open this trial for people with moderate to severe neuropathy pain and symptoms, and then with fall risk. Then we randomize them into yoga group, into education group, into usual care group, observation group. And then we just got the funding, get the trial started. And then hopefully we'll, right now we have 6 patients. We're hoping to finish enrolling by the end of 2025. And then last and not least, it's music therapy versus cognitive behavior therapy. So this is a trial. As we know, 1 in 3 cancer survivors suffer from anxiety. And then sadly, 64% cancer survivors takes more than 5 medications. And then, so if you tell them to take additional medication for anxiety, it's not necessarily well received, although people can, but non-pharmacologic treatment is needed. So right now, first-line treatment include like cognitive behavior therapy, and then music therapy has also been shown to be helpful as well. So how about let's try to compare them. And then this is the first randomized control trial to compare virtual music therapy versus virtual cognitive behavior therapy for anxiety in cancer survivors. So if you're interested, you can let us know, and then we can reach out to you. So in summary, I think leading cancer centers really incorporate integrated medicine into cancer care delivery, and patients and clinicians should be aware of integrated medicine modalities available to cancer patients. And a number of integrated medicine therapies can be recommended to cancer patients, and further studies are definitely needed. And then those are the list of further information, sources for further information. I'm happy to take any questions.
Awesome. Thank you so much. Please feel free to put your questions in the chat, or if you feel comfortable speaking up, that's fine too. Just know that you will be on the recording if you do speak, because the recording captures the presenter. But if you're comfortable with that, please feel free. I did get a couple of questions sent to the chat, just personally to me. So one is with alternative medicine, how do you know if something will be harmful? You mentioned that the kind of lower 2 boxes. How would one know if something would be harmful?
Honestly, the fact they say don't do the standard treatment that has been shown to be helpful and use my treatment only, I mean, that's red herring. And I unfortunately have witnessed, since I've been here, at least 10 patients going that route, and the outcome was pretty sad. So I'm a firm believer that you just, I mean, for breast cancer at least. I think for prostate cancer is a different story. There is actually a study, showed that for breast cancer patients, if they do alternative treatment, that increased the death rate from breast cancer by 2 times. So double the risk to die from breast cancer if you only use alternative medicine. And that's actually the fundamental definition of alternative medicine. They just say, don't use any like standard treatment, just do my way. And then there's so many different things they say. I mean, I see patients use like certain sort of herbs and certain other things, and it just and they go to a specific clinic in certain country, and then they I mean I don't necessarily want to make this session a bashing session of alternative medicine, but I just want to say be careful.
Of course. Yeah, of course. Do you have any suggestions for CBT therapists?
CBT, you mean cognitive behavior therapy? You mean suggestions? So MSK has one. Yeah, actually it has a service. Yeah, so our psychiatry department offer it, our integrative medicine service offer it. Like we trained our nurse practitioner to do it. So we can certainly do it. And the psychiatry department, I think, has like more than 1 people doing it. Yeah, so it's definitely available at MSK. I'm not sure where people are from. So, you know, in your local hospital and stuff, feel free to ask them about the CBT and see if they have any availability. Yeah, I mean, it's pretty well known in psychiatry department, like psychotherapy world. Yeah.
Yeah. Is there a recommended daily dose of vitamin D for breast cancer survivors?
So standard is 2,000 international units. And then, but I would usually recommend people to check it every 6 months and then adjust the level, adjust the dosage according to the level. Yeah.
Do you have a recommendation on which herbs to avoid for estrogen positive breast cancer?
There are lots of them. So it's, so the herb is, one is astragalus. It's good for the lung qi, like, you know, energy in lung, but it has phytoestrogen. And angelica, it has phytoestrogen. And then, you know, there's a list of them. So I can't really list all of them. So that's why I usually say, if you're doing some herbs, make sure let your doctor know, let your integrative medicine doctor know, and then we can give you certain recommendation. Yeah.
Great. I'm going to read this question verbatim from one of the members. Can you recommend someone or a medical center in Chicago doing acupuncture and yoga for breast cancer patients? I'm being treated at the University of Chicago. Do you have any Chicago colleagues?
I'm not too familiar with Chicago, so, but that's a good question. I mean, there's a research person working, I think, in Chicago. She's very interested in integrative medicine, so she's volunteered to work with me. So I can ask her to find out. I know like it's pretty prevalent there as well. I don't know, like Chicago has it either. So feel free to send me email and stuff, and then I can try to get back to you about the acupuncture center there. Yeah.
Okay, great. I'll send that email on behalf of the member and coordinate that answer. That's wonderful. Thank you.
Sure.
For those of us who are in ED and have neuropathy, do we have to be near one of the MSK hospitals to participate in one of the trials?
We do have those in 7 sites right now. We haven't opened it up in other sites. The reason being is actually we have the study has 3 aims. One is to see if real acupuncture is better than sham acupuncture in reducing CIP and pain. The second is to see if it can like improve quality of life and improve nerve fiber function. And the third one is actually to see if there's any predictive markers, meaning we need a special device, $30,000 device to measure patients' condition pain modulation. So, and then if we measure it in everyone, the hypothesis is patients who has intact conditioned pain modulation respond better to real acupuncture than sham acupuncture. And for patients who has impaired CP, conditioned pain modulation, they actually respond better to sham acupuncture than real acupuncture. So, because it's, and another device is pressure pain threshold. The hypothesis is people with high pressure pain threshold respond better to real acupuncture. So these two devices together is $50,000. So in order for us to open it in other site, actually other cancer center already requested, we kind of need that $50,000 device and send to them and train them and to do it. So right now we don't have that money yet. But we'll see if we reach that point. We'll potentially will ask NCI to get additional funding to do that and send it over and train them. Yeah.
Great. Awesome. We have a bunch more questions.
Sorry, for the yoga one is open everywhere. So
okay.
Yeah, yoga CMP one. We're just in the final stage of making it fully virtual. Because for many reasons, initially we were going to do the group yoga session and all that, and thanks to COVID, that's not possible. So and then we are changing everything to virtual at this point. So give us a few more weeks, and then we can open it up everywhere. Yeah.
Awesome. What are your thoughts on eating soy products for those who are ER positive breast cancer?
I think that's been studied. So I'm against using those like protein product extracted from like soy and stuff. I think it's too concentrated. But soy product itself, like as whole food, I'm actually okay with it as long as like the moderation. So I would say no more than 1 serving per day. Just because the data in like whole foods from the soy products is actually observational study. It shows it seems to help. And then, yeah, so I'm okay with not too much. A little bit is fine. Moderation, yeah.
Yep. Do you have a resource for herb recommendations for somebody with HER2 positive breast cancer?
I think there has been some studies suggesting like a turkey tail mushroom is potentially helpful for HER2 positive breast cancer. So on the condition it doesn't interfere with your other medication, I think that's reasonable to add it to your supplements. Yeah.
Thank you. What do you think of AngioStop and Myomin supplements from Dr. Chi? Are you familiar with those?
Not really. Yeah. So if you want, you can potentially, send us more information and Nancy can send it to me. We'll do some research and get back to you. Yeah.
AngioStop is a sea cucumber, is what the member said.
Got you. Sea cucumber. Yeah. I mean, I eat it a lot, but yeah,
yeah.
I'm not sure. Yeah, I'm not too well familiar with the research behind it. Yeah.
Yeah. Got it. And just a quick, so the presentation, the video of this presentation will be made available. So everybody will be able to see the slides again by watching the video. That was a question in the chat. All right, I've got a few more. So you mentioned a Tibetan pain patch. I'm curious what that entails. I've never heard of that.
Yeah, so this is a pain patch developed in Tibet, actually not Tibet. Apologize, it's actually in China. So yeah, in that part, and then so they noticed that people with arthritis use lots of those herbs. They just kind of collect those herbs and then like kind of break them and then put it on their like joint, and it helps. Then the company developed basically make those herbs into those patch, and they collect those herbs and then put them into a pouch and then give you some kind of activating liquid. Then you activate it, and then the herbs include, they have some curcumin in it and some like special Tibetan herbs, and then and then you put it on the pain site where it hurts for 4 to 8 hours, then you take it off, and it's significantly help with some patients' pain. Not all, but especially for like arthritic kind of pain, it really helps. So that's why we're doing a study to see who will benefit from it. Yeah.
Interesting. Another question that came through, what do you recommend for increasing white blood cells? I found that shiitake may be helpful. What do you think?
I think in general, the mushroom can help because they have those like beta glucan as the active ingredients. It kind of stimulate the immune system. In terms of whether they increase the white cell count, I'm not sure because we actually did a study. It did not increase the white blood cell count. What it did is actually increase its activity in fighting bacteria or virus. So, so I think that's why if there's no contraindication like allergy or interaction with other medication, I think it's reasonable to potentially add it to your regimen. Yeah.
Yeah. So we see a lot of information or kind of buzzwords about reducing inflammation. Are there herbs and supplements that you might recommend to help reduce inflammation?
Yeah, so ginger really helps reduce inflammation, and all this green leafy vegetable really help reduce inflammation. Yeah, I mean, you can even Google it, anti-inflammatory diet. So basically, lots of and some seafoods reduce inflammation. Yeah, but majority are like those plant-based diet help reduce inflammation.
Yep. What herb will support the thymus because the thymus produces white blood cells?
I don't know that on top of my head. So, if you have some herbs in your mind, feel free to put it in. But yeah, I don't pretend I'm like an expert in herbs. But yeah, and I think I read like, but I don't remember the name. So I'll just have to table that. Yeah.
Yep, got it. All right, another one. So there's also a lot of conversation about overall gut health. Do you have thoughts on that and how that might help prevent recurrence or help with with cancer patients' overall health?
I think so. I think there's some data about probiotics, especially using it with immunotherapy. It seems to like really improve the efficacy and improve the immune system. So in general, I think gut health is important, and probiotics is actually pretty good to help. So I'm supportive. Yeah.
Mm-hmm. Mm-hmm. Yep. Um, Excellent. And then do you have thoughts on supplements that might help prevent recurrence? I think that all of us are prevention of recurrence is top of mind for all of us.
Yep. Yeah. So if you ask all the cancer survivors, what's the number one thing bothers you is the fear of cancer recurrence. So it's definitely, and I think it's number one driving force for the anxiety. I don't have magic bullets for that. I wish. But in general, I think a few things may help. Definitely help, I think, is exercise. So just because exercise, like basically all the trials shows exercise help with so many different areas. So help you sleep better, help you feel better, help with everything. So exercise, exercise, exercise. Try to be active. That's one. And then I do think sleep well helps as well. In general, yeah. So do everything possible you can to help you sleep better helps. And then in terms of herbal supplements or dietary supplements, I actually think the mushroom is pretty promising. Yeah, you can potentially take some mushroom, can potentially boost your immune system. And then even if just like integrated in your diet, make sure you cook the mushroom, not eat them raw, just because the raw mushroom has carcinogen in it. So cook it either in the soup or like stir fry or something. Yeah, and then I think probiotic is very good. It seems there's good data, they improve immune system and all this, and improve GI health. So that's pretty good. And I think mind body approach, meditation, that basically never fails. It really helps people to have less anxiety and sleep better with better quality of life. And overall, just much make you feel much better. So I think everyone should learn meditation.
Mhm. Can you point us in a direction of some beginner resources for meditation?
Mm-hmm. Yeah, so there's a few apps you can use. I mean, one is Headspace, and another is Insight Timer. Actually, really like that one. You can find all the things, great variety. And I'm sure I'm missing one. I think there's another app called Calm and some other. If you guys know any, feel free to share. And then if you want some more like interpersonal one, like, live people. So MSK developed during COVID because our service was shut down for 3 months. So we developed this integrated medicine at home program. So what does that has basically is, actually, I may just share a screen with you and just show you. I think, challenges is a good thing. Without COVID, we may never have this. So here, let me share screen with you. So this is it. So you can just Google integrated medicine at home, and then MSK. So that comes. So basically, it's a program, virtual program, $25 to be a member. 20 or 3 months is $60. And then with becoming a member, you have free access to 20 classes, virtual classes per week. And you can, if you have time, especially, you can really take advantage of all these classes. We have exercise class, meditation class, and dance and yoga and Tai Chi and meditation, music therapy, etc. Yeah, so that's something, and then you can just register right here. That's something I would recommend if people want to learn like live from people about doing music therapy or meditation. That's a great source.
Yeah, that's great. What are your thoughts on Keytruda or some of the other immunotherapy drugs that are coming on to the coming out for breast cancer treatment?
Yeah, especially for triple negative breast cancer. I think it's pretty good. The data is pretty convincing. We already integrated into our standard treatment. So all triple negative patients are receiving this. So I think it's very good. Yeah, and it seems to be well tolerated as well. Yeah.
And then, so just back to the mushrooms that you were mentioning, are there particular types of mushrooms that you might recommend?
Yeah, there's so many different kinds. I think, usually turkey tail mushroom is pretty good. Maitake mushroom is pretty good. Yeah, and then if you want to cook them, then in market is those like white button mushroom is pretty good. Yeah, so I would say it doesn't matter too much about what kind of mushroom, but mushroom in general is good. Yeah.
Awesome. And then can you one more time just say what to Google to find the classes that you just showed us, please?
Sure. It's called, let me just share screen again. Integrative Medicine at Home membership program.
Thank you.
You can just type in Integrative Medicine at Home, then it will pop up.
Thank you so much. Well, this is fantastic. And the questions have slowed down just a little bit, which is perfect timing because it's just about 7 o'clock. Thank you, Dr. Bao, so much for joining us tonight. This program was really informative and is a topic that we've been interested in hearing more about for quite a while now. So thank you so much for taking the time after a very busy day to share with us and to answer all of our questions. We really appreciate it. Thank you to all for joining us and for submitting questions. This was a really great meeting. We will meet again on March 15th and we will have a different topic. We have a different topic the third Tuesday of every month. So hopefully we will see you all again on March 15th. And again, have a wonderful night and really appreciate everybody joining.
Yeah, thank you so much. Take care.
All right, thank you.
Thank you.
Thanks.
Bye-bye.
Thank you so much.